Hello, my name is Monique Horton. I am the benefits coordinator here at GDOT, and today I will be going over your benefit options for plan year 2023. SHBP is the provider for the health insurance. I will go over your 2023 plan details. As we all know, the Affordable Care Act was passed to make sure that employers were offering affordable health care to their employees. Through SHBP, GDOT is in compliance. However, starting 2019, there is a $0 penalty for not having your health insurance for the tax year. All benefits are effective 30 days after employment. So if you start on the 1st of the month, your benefits go in effect the 1st of the next month. However, if you start on the 16th of the month, your benefits will not go into effect the month after that. So if your first deduction will be on the 24th of the month, if you have a deduction on the 24th of September, that means your benefits go into effect on October 1. However, if you have your first health deduction on October 24th, that means your health insurance does not go into effect until November 1. To make your online elections for your health benefits, please visit myshbpga.adp.com. Since you are a first-time user, you will need the one-time registration code of SHBP-GA. There is a new look to the health insurance website. If you have any questions, please feel free to give me a call. Your member services options for SHBP are you can send them an email at shbpservicecenter@adp.com, or they have a mobile app now. Please access your App Store for iPhone user or Google Play Store for Android users and download the ADP Solutions mobile app. You can make your online elections from your cell phone now. Also, SHBP has introduced Skip the Phone campaign. If you visit this website, it will give you a step-by-step navigation on how to navigate through your SHBP enrollment portal. If you need to contact SHBP at any time, they are available Monday through Friday from 8:30 a.m. to 5 p.m. Eastern Standard Time. For the 2023 plan year, we will offer Anthem, Blue Cross Blue Shield, HMO and HRA, Kaiser Regional HMO, United Healthcare HMO and HDHP plans. Available to you either through telemedicine or virtual visits, you have the option with Anthem to download the Live Health app and have virtual visits with the doctor. They will be able to provide you with prescriptions. Also, with Kaiser, you have the telemedicine where you can talk with a professional on a live chat and schedule an appointment if necessary. With United Healthcare, their virtual visits are through United Healthcare Health for Me app. Here you will also be able to see a live doctor and have prescriptions called in on your behalf. Coinsurance waivers are available for certain illnesses, such as diabetes, asthma, or heart conditions. If you fall under either of these categories, please contact the provider that you have chosen to see your eligibility. A few terms and conditions and definitions that I often get. What is a copay? A copay is a flat fee in which you would pay before you are seen by the physician. Coinsurance is the portion that you will be responsible for after your deductible has been met. A deductible is the amount that you are responsible for before the insurance starts paying its portion. Out-of-pocket max is the maximum amount that you will spend out of pocket towards medical, deductible, co-pays, co-insurance, and pharmacy costs. After out-of-pocket max are met, the insurance plan will cover at 100% for the remainder of the year. Eligible expenses are expenses covered under your health plan. A primary care physician is a doctor who would have a study and field as for family medicine, general practitioner, internist, obstetrician, or pediatrician. A specialist is a doctor that specializes in a certain field, like an endocrinologist or an ear, nose, and throat doctor. In-network providers are providers who have agreed to negotiated rates. Out-of-network providers are providers that have not agreed to negotiated rates and may not accept your insurance. However, you will be subject to paying a higher cost. A quick tutorial on how to choose a plan. So for the statewide HMO, which is Anthem and United Healthcare, you have access to providers nationwide. Copays are associated with certain services. Copays count towards your out-of-pocket max, however, do not count towards your deductible. And you have access to in-network providers only, except for emergency care. The regional HMO, which is Kaiser, it is a copay only option. There are no deductibles or co-insurance associated. All of your medical, pharmacy, and wellness visits will be done under the Kaiser roof. However, they do have a higher out-of-pocket max, and you must live or work within the 27 metro Atlanta counties. HRA, which is administered by Anthem, they are a credit-based insurance company that will help offset your medical and pharmacy costs. You do have access to in-network and out-of-network providers. You can get a flexible savings account to help offset any out-of-pocket costs. However, there are no co-pays. You only pay deductibles and co-insurance. And depending on your tier, because the HRA is tiered off into gold, silver, and bronze, that will dictate how high your deductible is. The gold plan, you will have a lower deductible. However, the silver plan, you will have a higher deductible and a lower premium, but the gold plan, you will have a higher premium. HDHP, which again is the high deductible health plan that is administered by United Healthcare. There are lower monthly premiums. You have access to in-network and out-of-network doctors. You also can get a health savings account to help offset any out-of-pocket costs. There are no copays associated with this plan. However, you have to meet deductibles and co-insurance, and these are higher deductibles with a lower monthly premium. The Anthem or United Care HMO, these plans are good for members who like predictable costs when visiting the doctor, have in-network physicians, and also good for those that want access to doctors nationwide. The Kaiser Regional HMO are good for members who do not like to meet deductibles, who will only be responsible for paying copays for any visits, and those that like to have all of their medical, pharmacy, and wellness services under one roof. Anthem, HRA, are good for those who want access to in-network and out-of-network doctors. You are given credits at the beginning of each plan year by SHBP. The gold level, you will pay a higher copay but a lower deductible. With the bronze plan, you will pay a lower monthly premium with a higher deductible. HDHP, which is United Healthcare, you have access to in-network and out-of-network doctors. You will save money on your premium. However, remember, it is a higher deductible that must be met before the insurance company pays their portion. So in this scenario, we're going to say that you have not visited the doctor at all for the plan year. Each scenario breaks down how the plan will process your doctor's visit. For the Anthem HMO, it is said that the negotiated rate for insurance and for a doctor's visit will be $125. So once you go to the doctor and they run your insurance, if you have the Anthem HMO, you will be responsible for a $35 copay. That $35 counts towards your out-of-pocket max, and that is with United and Anthem. The regional HMO, which is Kaiser, that is a copay only option. So when you go for a sick appointment, you will be responsible for a $35 copay before you're seen by the physician. For HRA, which is Anthem, this scenario, we're using the Silver plan. That is the middle plan of the HRA options. Your deductible is $2,000. Your out-of-pocket max is $5,000. But SHBP has given you 200 credits, which are dollars, towards your plan. So your doctor's visit is $125. At your doctor's visit, you will not be responsible for paying any out-of-pocket costs because the value of that visit, which is $125, will be deducted from your 200 credits that you were given by SHBP for the plan year. That leaves you with the remainder of 75 credits for the rest of the year. But we will go over later in the presentation how you can earn additional credits to help offset any out-of-pocket costs. A good thing is that the $200 that is going to the $125 that you're paying for the sick appointment goes towards your deductible and your out-of-pocket cost. For the HDHP plan, since it is the high deductible health plan and for an employee only, the deductible is $3,500. Remember, you have to meet your deductible before the plan pays anything. So at the time of that sick appointment, which is a value of $125, you would have to pay $125 before you are seen by the physician. That $125 does decrease your deductible and out-of-pocket cost. For the second scenario, we're going to view outpatient surgery. For outpatient surgery, it has been deemed that it will cost $2,000 for the physician and the facility. This is before insurance is applied. For the statewide HMO, which again is Anthem and United Healthcare, you have a $1,300 deductible, a $4,000 out-of-pocket max with 20% co-insurance. So that means that you will pay the first $1,300, which is your deductible. You will pay 20% of the remaining balance. So that's $18,700 of the remaining, plus 20% of the co-insurance. After you have paid the $1,300 plus the $2,700, the rest of the year, the insurance company will cover you at 100%. For the regional HMO, which is Kaiser, since they are copay only, you will be responsible for paying a $100 copay before you receive the service. The $100 copay goes towards your out-of-pocket max. The Anthem HRA, in this scenario, we are using the Silver plan again. The deductible is $2,000. Your out-of-pocket max is $5,000, and you are given the 200 credits by SHBP. So in this scenario, you have not used the 200 credits, nor have you paid anything towards your deductible or out-of-pocket max. This means that you will be responsible for the $2,000 deductible and 20% of the remaining balance of $18,000. Since your out-of-pocket max is $5,000, you would only pay the $2,000 and the 20% of the copay, but your maximum amount for this $20,000 surgery will be $5,000. So you would basically pay your out-of-pocket max. The remainder of the year, everything else is covered at 100%. For the HDHP plan, this is the high deductible health plan. Again, before any amount of money is paid by the insurance company, you have to meet the deductible. So you will be responsible for the $3,500 deductible. They have 30% co-insurance. So the $3,500 deductible will decrease the amount that you have to pay. So it's $16,500 is the 30% of the copay, which is $4,950. So you would pay your out-of-pocket max of $6,450. After that, everything else is covered. So a quick recap for the Anthem HMO and HRA. For the HMO, you have co-pays, co-insurance, deductibles. All preventative care is covered at 100%. Your medical and pharmacy costs count towards your out-of-pocket max. There are no referrals needed for specialists. You can earn incentive credits. They do participate in the disease management program, and your credits can roll over from year to year. The HRA plan, that is gold, silver, and bronze, you have co-insurance, deductibles, 100% for preventative care. Your medical and pharmacy costs count towards your out-of-pocket max. You have access to in-network and out-of-network physicians. There are no referrals needed for specialists. The plan does come with preloaded SHBP credits. You can earn additional credits. They also participate in a disease management program, and your credits can roll over from year to year. United Healthcare, HMO, and HDHP. With the HMO, you have copays, co-insurance, deductible, preventative care is covered at 100%. Your medical and pharmacy costs count towards out-of-pocket max. There are no referrals necessary for specialists. You can earn incentive credits. They do participate in a disease management program, and credits do roll over from year to year. For the HDHP plan, you have co-insurance, deductibles. Preventative care is covered at 100%. Your medical and pharmacy costs count towards out-of-pocket max. You have access to in-network and out-of-network doctors. There are no referrals needed for specialists. You can earn incentive credits. However, in order to use your incentive credits, you must have already met your deductible. They do participate in a disease management program, and credits can roll over from year to year. With Kaiser Regional HMO, they only have copays. Again, you must live or work within the 27 metro Atlanta counties. Preventative care is covered at 100%. Your medical and pharmacy costs count towards your out-of-pocket max. No referrals needed for specialists. However, referrals will be needed for certain specialists. You earn a reward card with Kaiser, and credits do not roll over from year to year unless you were previously enrolled in another SHBP option before you selected Kaiser. If you are planning to retire, please have health insurance 1 year prior to your retirement. So if your retirement date is January 1 and you have not had health insurance for the previous plan year, please make sure you sign up for health insurance during open enrollment of that year before you retire. For 2023, your pharmacy needs are going to be covered by CVS Caremark. Your 2023 pharmacy benefits for Anthem and United Healthcare will be administered by CVS Caremark. You will have the opportunity to choose any pharmacy that you would like. You don't necessarily have to go to a CVS pharmacy. They're only the administrators to ensure you are paying the lowest premium for any prescriptions. Kaiser is its own facilitator for its pharmaceutical needs. That does not mean that you cannot get a prescription filled at another pharmacy. Please be aware that if you do, you may be subject for the full cost of that prescription. What is a wellness incentive? Wellness incentives from Anthem and United Healthcare help offset your co-pays, co-insurance, and deductibles. Now we'll go over your 2023 wellness incentives for Anthem and United Healthcare. For Anthem and United Healthcare, they have partnered with ShareCare. ShareCare gives you the opportunity as an employee to earn incentive points throughout the year to offset the cost of co-pays and maybe insurance, maybe prescriptions that you have. This will be done from January 1, 2023 until November 30th, 2023. To earn these incentives, you must do the following: take a real age test, participate in wellness incentives or well-being coaching, do a biometric screening, and they also have the option of some on-site activities. Once these are completed, you have the ability to earn 480 points. Once you do your real age test, you will receive 120 points. For your biometric screening, you will receive an additional 120 points. To get the full 480 points, you must participate in the following. You may take coaching calls, at least 4 for the calendar year, and remember that is from January 1 to November 30th. Or you can download the ShareCare app and participate in the different challenges from month to month. For example, they have a 5,000 step per day challenge, there is a stress challenge, and a green day challenge. Once you complete at least 2 of these, you will earn the additional 240 points. Once you have earned all of your 480 points, you can redeem them for the following incentives. You may choose a $150 Visa reward card that can be used anywhere Visa is accepted, or a $225 Walmart gift card that can only be used at the pharmacy or vision center. Or you can choose to redeem all points to your incentive points. So this is where if you have an HRA, the money that you're given from SHBP every year can add to this so that your visits to the doctor, you won't have out of pocket, you'll have these credits to help offset any out of pocket expenses. Kaiser has a similar well-being incentives and rewards. To participate in Kaiser's well-being incentives, you must do also between January 1 and November 30th. To earn your points with Kaiser, you must first download the app and agree. Take a total health assessment similar to the real age for Anthem and United Healthcare. Know your numbers. Also get age-appropriate cancer screenings and take online assessments. Once you have completed this, You will receive a $500 gift card that can be used anywhere that allows the MasterCard gift card. Also, all incentive rewards are available to any covered spouses. That is for Anthem and United Healthcare and Kaiser as well. TRICARE supplemental plan for military members will be offered for 2023 plan year. There are no change in the premiums. Peach Care for Kids is offered to state employees. This is up to children age 19. If this is something that you're interested in, please go to the Department of Community Health and fill out their application. They are the determining factor if you are approved or not. Here are a few helpful contacts. Also, again, if you have any problems getting into the SHBP portal, please contact myself or SHBP. Remember that if you are covering any dependents, whether that be a spouse or a child, they will be put in a pending process. So if they're put in the pending process, you will receive something from ADP Dependent Verification via mail. Please open it and process as soon as possible because it is deadline sensitive. For dependents, it usually asks for something like your birth certificate. For a spouse, I think the most common is your marriage certificate. You as the employee are automatically approved for health insurance, but anyone outside of yourself will be pending. So please, please, please look at your deadlines. If they have not received the information by the deadline, your dependents will be dropped. Now I will go over your flexible benefit options for the 2023 plan year. To make your online elections for your flexible benefits, please visit gabreeze.ga.gov. You will click the Are You a New User link. It will ask you the last four of your social and your birthday. After you have inputted that information, please enter all password retrieval options, whether it be entering a phone number or email address, and please set up your security questions and your phone PIN number. This will help you access the website for future use. The vendors for our flexible benefits are Cigna is the administrator of the dental HMO and PPO. The Standard is the administrator for short-term and long-term disability. WageWorks is the administrator for flexible spending accounts. MetLife will handle your life, accidental death and dismemberment, and legal plans. Unum, long-term care. Aflac, critical illness and accident. And last but not least, we have Anthem Blue View Vision for the vision insurance. For the 2023 plan year, dental insurance is offered by Cigna. They are the administrators of the DHMO and PPO plans. For the HMO plans, you must use an in-network provider only. Coverage is limited to where network providers are located. No maximum on benefit coverages or waiting period for any covered services. For the Cigna PPO plan, you have the option of using in-network and out-of-network providers. There are three options to choose from. You have Select, Select Mid, and Select Plus. The new dental implants and the orthodontia coverages are available under the new Select Mid plan as well as Select Plus plan options as well. For more details on the breakdown for the different plans, please view your 2023 You Decide booklet. Anthem Blue View Vision is the vision insurance. It has a Select and Select Plus plans. The copays differ in both plans, and I think one of the most prominent differences in both plans, with the Select plan, you are given a $130 allowance towards the cost of frames twice every 2 years. There is 20% off the remaining retail balance. With the Select Plus plan, you are given a $150 cost towards the cost of frames every year, with 20% off of the remaining balance. MetLife is the administrator of all life insurance policies. For employee life, we offer 1 to 10 times your salary with a maximum coverage of $2 million. As a new hire, you are given the one-time opportunity to choose designated levels of insurance as a new hire before you have to provide medical underwriting. Coverage amount for one time up to $200,000 is guaranteed. Also associated with the life insurance, you have premium waivers if you become disabled. They do also allow you to do a will preparation. They will partner with Hyatt Legal to help you complete a will, living will, or power of attorney for you and your legal spouse at no charge. They also have estate resolution services. This gives your beneficiaries the support of, again, Hyatt Legal if they have problems with your estate. These are in person or via telephone visits. Again, for employee life, it is 1 to 10 times your salary. Spouse life is up to $250,000, and child life, $20,000. Accidental death and dismemberment, this is 1 to 10 times your salary as well, with a max coverage amount of $2 million. If this is something you are looking into, you will have to complete the Statement of Health online. This will be done after you have completed your Georgia Breeze enrollment. The Standard is the administrator of the short-term and disability insurance. For short-term disability, this is a 6-month disability plan that will pay you on a weekly basis. It is not for a permanent period of time. It will replace 60% of your salary on a weekly basis. There is a 7-day and a 30-day waiting period. The maximum amount of money each week that an employee can earn from short-term disability is $1,000. For long-term disability, you have to be out of work for at least 6 months or 180 plus days to be eligible. This only kicks in, again, after you have been out for 6 months. If you enroll as a new hire, you will not be considered a late enrollee. If this is an option that you are thinking about signing up for later during open enrollment, you will be considered a late enrollee. Saying that if you become disabled, and even if you chose a 7-day waiting period, and you didn't sign up for short-term disability when you became employed with the state, you will have to wait 60 days before your disability insurance pays you, even if you only chose a 7-day waiting period. If you do not sign up for long-term disability as a new hire, you will not have the option for it after being a new hire. Specified illness through AFLAC, we have coverage for employees and spouses, both up to $50,000. If you get specified illness for yourself, your children are covered at 50% at no cost. For the specified illness, if you have a heart attack and you chose the $50,000 coverage level, for your heart attack, you will receive a check for $50,000. If you have another heart attack at least 12 months past the first one, you will only get half of the value of your coverage level. So again, if you chose the $50,000, your check will only be for $25,000. Long-term care administered by Unum. What is long-term care? This is care that you, your spouse, your parents, or your parents-in-law have access to help you with your day-to-day living. This can help you with bathing, dressing, going to the bathroom, eating, and if you suffer from cognitive impairment such as Alzheimer's. Again, you, your spouse, your parents, and your parents-in-laws are covered. If this is something that you're interested in for yourself, it can be payroll deducted. However, if you're interested in anyone other than yourself, such as a family member, you will be direct billed by Unum and you will pay Unum directly. In your Georgia Breeze enrollment portal, you will not see a link for you to sign up for Unum. Please visit unuminfo.com/SOG to get your rate calculator and the enrollment portal. For your legal insurance, MetLife Legal Plans is the administrator. You have Select, Select Plus, and Select Premium options. If you choose a Select Premium option, you will have all options under Select Premium as well as Select and Select Plus plan. If you choose Select Plus, you have all options under Select Plus and the Select plan. However, if you just choose the Select plan, you only have the options available under the Select plan. This is a nationwide benefit that is available to you 24 hours a day, 7 days a week. WageWorks is the administrator of our flexible spending accounts. The first one is the healthcare spending account. The maximum allowance allowed is $2,808. With your healthcare spending account, the amount of money you elect for the plan year is readily available for you to use on January the 1st. This can be used to offset costs for deductibles, copays, contact lenses, glasses, and prescriptions. There are a full list of ways that you can use your healthcare spending account money. For the dependent care spending accounts, the maximum allowance is $4,992. This benefit works a bit differently than the healthcare spending account. This is more of a pay up front and you reimburse later. So if you have costs for daycare, you will first pay that daycare cost, hold on to that receipt, and once that amount is in your balance, you can submit that receipt for reimbursement of the cost of your daycare. So on the 24th of each month, which is a pay period, the 1st through the 15th, you will see deducted from your check ERS, 401k, if you choose healthcare dependent care spending accounts, and health insurance premiums. The reason that you see the healthcare and dependent care accounts is because, remember we talked about putting the monthly amount? This will automatically split it up into 2 payments that you will see on the 24th and your 9th check. There's also a $3.20 administrative fee that is also split in half that's added to your premium amount. On the 9th of the month, you will see deducted from your paycheck your ERS, your 401k deductions. If you choose a healthcare dependent care spending account, all other flexible benefit premiums, and anyone who works in the Go office, your parking. These are a few numbers associated with each insurance company. Again, I am Monique Horton. I'm the benefits coordinator here. If you have any questions, please feel free to give me a call at 404-631-1234. 1505, or I can be reached via email at mhorton@dot.ga.gov. Welcome to GDOT.